Chronic venous insufficiency, a question and answer session, a deep dive into causes, symptoms, treatments, and living well. Welcome to this in-depth podcast episode, where we explore the complexities of chronic venous insufficiency. In this episode, we present 100 carefully organized questions and answers, each designed to clarify key aspects of chronic venous insufficiency, from its causes and symptoms to management strategies and special considerations. Join us as we guide you through everything you need to know in a formal, clear, and informative dialogue. Pause the video after each question to attempt answer. Let's begin. Section 1. Understanding chronic venous insufficiency. Question: what is chronic venous insufficiency? Answer: chronic venous insufficiency is a long-term condition in which the veins in the legs are unable to pump blood effectively back towards the heart. This inefficiency results in blood pooling within the legs. Question: what is the main cause of chronic venous insufficiency? Answer: the primary cause is high pressure within the leg veins, also known as venous hypertension. This occurs due to malfunctioning valves inside the veins, which normally prevent blood from flowing backward. Question: what is the difference between varicose veins and chronic venous insufficiency? Answer: varicose veins are a symptom of underlying venous disease. Chronic venous insufficiency is a broader diagnosis that includes the functional failure of the venous system, which may lead to varicose veins as well as more severe symptoms such as swelling, skin changes, and ulcers. Question: are spider veins the same as chronic venous insufficiency? Answer: no. Spider veins, also known as telangiectasias, are tiny, dilated surface veins. They are usually a cosmetic issue but can sometimes be associated with underlying chronic venous insufficiency, particularly if they are numerous. Question: what are the risk factors for developing chronic venous insufficiency? Answer: key risk factors include increasing age, family history, being female, pregnancy, obesity, prolonged periods of standing or sitting, a history of deep vein thrombosis, and smoking. Question: is chronic venous insufficiency a serious condition? Answer: yes, even though it may begin with mild symptoms. If left untreated, chronic venous insufficiency is progressive and can lead to significant complications such as chronic pain, severe swelling, skin ulcers, cellulitis, and deep vein thrombosis. Question: can chronic venous insufficiency be cured? Answer: chronic venous insufficiency is a chronic condition that can be managed effectively to halt progression, but the underlying vein wall and valve damage cannot usually be reversed. The main goal of treatment is to control symptoms and prevent complications. Question: how is chronic venous insufficiency diagnosed? Answer: diagnosis involves a physical examination and a duplex ultrasound, which is the gold standard for visualizing blood flow and assessing for faulty valves or blockages in the veins. Question: what is the SEEP classification? Answer: the SEEP classification is a standardized system used by physicians to classify the severity of chronic venous insufficiency. SEEP stands for clinical, etiological, anatomical, and pathophysiological, with clinical classes ranging from 0 to 6, representing no visible signs to active ulceration. Question: can men get chronic venous insufficiency? Answer: yes. Although the condition is more common in women, it does affect a significant number of men. Section 2. Symptoms and signs. Question: what are the most common early symptoms of chronic venous insufficiency? Answer: early symptoms include heaviness, aching, tiredness, and swelling in the legs, particularly after long periods of standing and towards the end of the day. Question: why does swelling occur in chronic venous insufficiency? Answer: swelling, or edema, occurs because fluid from the blood leaks into the surrounding tissues due to high pressure within the veins. Question: what is the meaning of venous claudication? Answer: venous claudication is painful cramping or aching in the legs during walking, caused by the inability of the compromised venous system to accommodate increased blood flow during exercise. Question: what do skin changes in chronic venous insufficiency look like? Answer: skin changes may include brownish or gray discoloration, dryness, itching, and hardening of the skin, known as lipodermatosclerosis. Question: what is lipodermatosclerosis? Answer: lipodermatosclerosis is a condition where the skin and underlying fat, usually around the ankles, become inflamed, hardened, and painful. It is a sign of advanced chronic venous insufficiency. Question: what is a venous stasis ulcer? Answer: a venous stasis ulcer is an open wound, usually on the inside of the ankle, resulting from long-term chronic venous insufficiency, where poor blood flow prevents proper healing of the skin. Question. Why do my legs itch with chronic venous insufficiency? Answer. Itching results from the accumulation of waste products and inflammation in the skin caused by poor circulation, often referred to as venous eczema or stasis dermatitis. Question. Do symptoms get worse at night? Answer. Aching and discomfort can intensify at night because blood that has pooled in the legs during the day increases pressure when lying down. Question. Can chronic venous insufficiency cause restless leg syndrome? Answer. Yes. There is a strong association. The uncomfortable sensations from chronic venous insufficiency can trigger or worsen the urge to move the legs. Question. Are leg cramps common in chronic venous insufficiency? Answer. Yes. Night cramps are common, although the exact reason is not fully understood. Section 3. Conservative management and lifestyle changes. Question. What is the first-line treatment for chronic venous insufficiency? Answer. The first-line treatment is always conservative management, which includes compression therapy, elevating the legs, regular exercise, and weight control. Question. How does leg elevation help? Answer. Elevating the legs above heart level uses gravity to help drain pooled blood and reduce swelling. It is recommended to elevate the legs for 30 minutes, 3 to 4 times daily. Question. What type of exercise is best for chronic venous insufficiency? Answer. Walking is highly beneficial, as calf muscle contractions act as a secondary pump for blood return. Swimming and cycling are also effective forms of exercise. Question. Why is weight management important? Answer. Excess weight increases pressure on abdominal veins, which can worsen venous reflux and aggravate chronic venous insufficiency. Question. Should I avoid standing or sitting for long periods? Answer. Yes. Prolonged immobility impedes venous return. If your occupation requires it, take frequent breaks to move and flex your ankles. Question. Are there dietary changes that can help? Answer. A low-salt diet helps reduce fluid retention and swelling, while a high-fiber diet can prevent constipation, which increases abdominal pressure. Question. How much water should I drink? Answer. Staying well hydrated helps maintain blood volume and blood viscosity, making circulation easier. Question. Is it okay to cross my legs? Answer. It is best to avoid sitting with legs crossed for extended periods, as this can impede blood flow behind the knee. Question. What kind of shoes should I wear? Answer. Low-heeled shoes are preferable to high heels, as they promote more effective calf muscle pumping. Question. Can smoking affect chronic venous insufficiency? Answer. Yes. Smoking damages blood vessels and impairs circulation, thus worsening chronic venous insufficiency. Section 4. Compression therapy. Question. What is compression therapy? Answer. Compression therapy involves wearing specially designed stockings or bandages that apply graduated pressure to the leg, which is tightest at the ankle and decreases up the leg to assist with blood return. Question. How do compression stockings work? Answer. They provide external support to the vein walls, improve the function of damaged valves, and reduce the diameter of veins, all of which help blood flow upwards. Question. What is the difference between support hose and medical compression stockings? Answer. Support hose offer mild, uniform pressure and are available over the counter. Medical compression stockings deliver specific, graduated pressures and require a prescription. Question. What do the compression levels mean? Answer. Compression levels, measured in millimeters of mercury, indicate the amount of pressure applied at the ankle. Higher numbers represent stronger compression. Question. Which compression level do I need? Answer. Mild compression is for minor swelling, tired legs, or pregnancy. Moderate compression is most common for chronic venous insufficiency and varicose veins. High and very high compression are reserved for severe cases, significant swelling, or ulceration. Question. How long should I wear compression stockings each day? Answer. They should be put on first thing in the morning, when swelling is minimal, and worn until bedtime. Question. How do I put on compression stockings? Answer. Turn the stocking inside out to the heel. Slide your foot in, then gradually roll or pull the stocking up the leg, ensuring it is smooth and untwisted. Question. Are there devices to help put them on? Answer. Yes. Tools such as donning gloves, frames, and slides can make wearing compression stockings easier. Question. How do I care for my compression stockings? Answer. Hand washing with mild soap and air drying preserves their elasticity. They typically require replacement every 3 to 6 months. Question. What if I cannot tolerate full-length stockings? Answer. there are alternatives such as open-toe stockings, thigh highs, and compression wraps or Velcro devices, which may be easier to use. Section 5. Medications and topical treatments. Question: are there medications for chronic venous insufficiency? Answer: no medication can repair valve damage, but some can help relieve symptoms. Question: what are phlebotomic drugs? Answer: phlebotomic drugs are usually plant-derived medications, such as horse chestnut seed extract, diosmin, and hesperidin, which are thought to improve venous tone and decrease inflammation and capillary permeability. Question: is horse chestnut seed extract effective? Answer: research indicates that horse chestnut seed extract can be as effective as compression stockings for mild to moderate chronic venous insufficiency, but always consult your physician before use. Question: what about diosmin? Answer: micronized purified flavonoid fraction, which contains diosmin, is a prescription medication in many countries and has good evidence for reducing symptoms and healing venous ulcers. Question: can aspirin help? Answer: low-dose aspirin is sometimes recommended for its anti-inflammatory and antiplatelet effects, which may help with symptoms and ulcer healing. However, it is not a main treatment. Question: what creams can I use for the skin? Answer: emollients and moisturizers are essential for treating dry, itchy skin. Topical steroids may be prescribed for short-term use if there is significant inflammation or itching. Question: can I use antibiotic cream on a venous ulcer? Answer: only use antibiotic cream if prescribed by your doctor for a specific infection. Routine use can result in antibiotic resistance and contact dermatitis. Question: are diuretics used for swelling in chronic venous insufficiency? Answer: diuretics are rarely used, and only for short-term relief of severe swelling. They do not address the underlying cause and can lead to electrolyte imbalances if misused. Question: what is pentoxifylline? Answer: pentoxifylline is a medication that improves blood flow and is sometimes used as an adjunct therapy to help heal venous ulcers. Question: should I take supplements for chronic venous insufficiency? Answer: always discuss supplements with your doctor first. Some, such as horse chestnut, can interact with other medications. Section 6. Minimally invasive procedures. Endovenous ablation. Question: when is a procedure recommended for chronic venous insufficiency? Answer: procedures are recommended when symptoms are severe, interfere with quality of life, or when complications such as skin changes or ulcers develop despite conservative measures. Question: what is endovenous thermal ablation? Answer: endovenous thermal ablation is a minimally invasive procedure in which a thin catheter is inserted into the diseased vein and heat energy, either from a laser or radio frequency, is used to seal the vein shut. Question: what is the difference between endovenous laser ablation and radio frequency ablation? Answer: endovenous laser ablation uses laser energy, while radio frequency ablation uses radio frequency energy, but both are highly effective and have similar success rates for closing the affected vein. Question: how is ultrasound guidance used? Answer: duplex ultrasound is used in real time to map the veins and guide the catheter to the correct location during the procedure. Question: is the procedure painful? Answer: the procedure is performed under local anesthesia, so there is little or no pain, although a sensation of heat or pulling may occur. Question: what are the advantages over vein stripping surgery? Answer: endovenous procedures offer faster recovery, less pain, no large scars, lower risk of infection, and can usually be performed in an office setting without general anesthesia. Question: what happens to the blood after the vein is closed? Answer: blood is rerouted through healthy deep veins in the leg, and the treated vein eventually shrinks and is absorbed by the body. Question: what is recovery like after ablation? Answer: walking is encouraged immediately after the procedure. Compression stockings are worn for 1 to 2 weeks, and most individuals return to normal activities within a few days. Question: what are the potential risks of ablation? Answer: risks are low but may include bruising, temporary numbness, skin burns, inflammation of the treated vein, or rarely, deep vein thrombosis. Question: how successful is endovenous ablation? Answer: success rates are very high, typically exceeding 95%. Section 7. Other procedures. Sclerotherapy, phlebectomy, surgery. Question: what is sclerotherapy? Answer: sclerotherapy is a procedure where a liquid or foam solution is injected into a vein, causing irritation and closure of the vein. Question: what veins is sclerotherapy used for? Answer: Sclerotherapy is primarily used for smaller varicose veins and spider veins that remain after treating larger underlying issues. Question: what is ultrasound-guided foam sclerotherapy? Answer: this technique employs ultrasound to guide the injection of a foam solution, allowing treatment of larger or deeper veins not visible on the surface. Question: what is ambulatory phlebectomy? Answer: ambulatory phlebectomy is a minimally invasive surgical technique where varicose veins are removed through tiny punctures in the skin using a special hook, resulting in small scars. Question: when is phlebectomy used? Answer: phlebectomy is often performed alongside endovenous ablation to remove bulging surface branches of the treated vein. Question: what is vein stripping and ligation? Answer: this traditional surgical procedure involves tying off and physically removing the great saphenous vein through incisions in the groin and knee. It has largely been replaced by endovenous ablation. Question: when might surgery still be necessary? Answer: surgery may be required in cases of very large, twisted veins, or if minimally invasive procedures are unsuccessful or not feasible. Question: what is the recovery time for vein stripping? Answer: recovery typically takes 2 to 4 weeks, with significant bruising and pain. Question: what is the Chiva procedure? Answer: the Chiva procedure is a technique that aims to correct venous flow by tying off specific points rather than removing the vein. It is less commonly performed. Question: are there new procedures being developed? Answer: yes. New methods include mechanochemical ablation, which combines a rotating wire and solution, and cyanoacrylate, also known as vein glue, which seals the vein with medical adhesive. Section 8. Managing complications. Venous ulcers. Question: what is the most important step in healing a venous ulcer? Answer: sustained, adequate compression therapy is the cornerstone of ulcer healing. Question: what types of compression are used for ulcers? Answer: multi-layer compression bandage systems are most effective, as they maintain constant pressure better than compression stockings alone. Question: how is the wound itself cared for? Answer: the wound is cleaned and dressed with specialized dressings, such as foam, alginate, or hydrocolloid, to manage moisture and protect the surrounding skin. Question: what is debridement? Answer: debridement is the removal of dead or unhealthy tissue from the ulcer bed to promote healing. This can be done surgically, mechanically, or with enzymatic dressings. Question: how long does it take for a venous ulcer to heal? Answer: with proper treatment, most ulcers improve within weeks, but complete healing can take several months. Question: what can be done if an ulcer is not healing? Answer: a vascular specialist should reassess the diagnosis and treatment. Other causes, such as arterial disease or infection, must be ruled out, and advanced wound care or skin grafts may be necessary. Question: what is a skin graft? Answer: a skin graft involves placing a thin piece of healthy skin from another body part or using a synthetic substitute over the cleaned ulcer to encourage healing. Question: how can I prevent an ulcer from coming back? Answer: lifelong use of compression therapy is the most critical factor for preventing recurrence after healing. Question: what are the signs of an infected ulcer? Answer: signs include increased pain, redness, swelling, warmth, pus, foul odor, and fever. These symptoms require immediate medical attention. Question: can I exercise with a venous ulcer? Answer: yes, if your doctor approves. Gentle exercises such as ankle rotations and walking, if not too painful, can improve circulation and support healing. Section 9. Living with chronic venous insufficiency and prognosis. Question: can chronic venous insufficiency be prevented? Answer: while it cannot always be prevented, risk can be greatly reduced by maintaining a healthy weight, exercising regularly, avoiding prolonged standing or sitting, and wearing compression stockings if at high risk. Question: is it safe to fly with chronic venous insufficiency? Answer: yes, but precautions such as wearing compression stockings, staying hydrated, moving about periodically, and doing ankle exercises are essential to lower the risk of deep vein thrombosis. Question: can I massage my legs if I have chronic venous insufficiency? Answer: gentle, upward stroking massage is generally safe. Deep, forceful massage on varicose veins should be avoided, as it could potentially dislodge a clot. Always consult your doctor. Question: what is the long-term outlook for someone with chronic venous insufficiency? Answer: with consistent management, including lifestyle changes and compression therapy, progression can be halted, symptoms controlled, and complications prevented. The prognosis is excellent with proper care. Question: How often should I see my doctor for chronic venous insufficiency? Answer. If stable, annual checkups may suffice. With active symptoms or ongoing treatment, more frequent visits are necessary. Question. Does chronic venous insufficiency affect life expectancy? Answer. The condition itself does not reduce life expectancy, but complications such as deep vein thrombosis can be life-threatening if untreated. The main impact is on quality of life. Question. Can chronic venous insufficiency affect both legs? Answer. Yes, it commonly affects both legs, although one leg may be more severely affected. Question. Is it okay to use a hot tub or sauna? Answer. Heat causes veins to dilate, which can worsen symptoms. Limit exposure and elevate your legs afterwards. Question. What should I look for in a healthcare provider for chronic venous insufficiency? Answer. Seek out a vascular surgeon, vein specialist, or dermatologist with expertise in venous disease. Question. Are there support groups for people with chronic venous insufficiency? Answer. Yes. Many online forums and patient advocacy groups, such as the Vascular Disease Foundation, offer support and information. Section 10. Special considerations. Question. How does pregnancy affect chronic venous insufficiency? Answer. Pregnancy increases blood volume and relaxes vein walls due to hormonal changes, and the growing uterus puts pressure on pelvic veins. Chronic venous insufficiency often develops or worsens during pregnancy but typically improves after delivery. Question. Is compression therapy safe during pregnancy? Answer. Yes. Compression therapy is the primary and safest treatment for chronic venous insufficiency during pregnancy. Special maternity stockings are available for comfort. Question. Can vein procedures be done during pregnancy? Answer. Elective procedures are postponed until after delivery, as the condition may improve on its own and to avoid risks to the fetus. Question. How is chronic venous insufficiency managed in the elderly? Answer. The same principles apply, but challenges may include difficulty applying stockings due to arthritis or frailty. Simpler devices and caregiver assistance are often needed. Question. What if I have both arterial disease and chronic venous insufficiency? Answer. This is known as mixed etiology. Compression must be used with extreme caution, as it may reduce arterial blood flow. A vascular specialist must determine the appropriate level of compression. Question. What is the ankle brachial index? Answer. The ankle brachial index is a test that compares the blood pressure in your ankle to that in your arm. It is essential to perform before prescribing compression therapy to rule out significant arterial disease. Question. Can weight loss surgery help with chronic venous insufficiency? Answer. For individuals who are morbidly obese, significant weight loss from bariatric surgery can dramatically improve or even resolve symptoms by reducing pressure on the venous system. Question. Does health insurance cover chronic venous insufficiency treatment? Answer. In most cases, if treatment is medically necessary, such as for symptom relief or ulcer healing, insurance will cover it. Pre-authorization is often required. Question. Are there any new technologies on the horizon for chronic venous insufficiency? Answer. Research continues into improved biological understanding, better medications, less invasive procedures, and wearable technology for monitoring leg swelling. Question. What is the single most important thing I can do for my chronic venous insufficiency? Answer. Be consistent. Adhering daily to your prescribed management plan, particularly compression therapy and staying active, is essential for controlling the condition and maintaining a good quality of life. Thank you for joining us on this comprehensive podcast about chronic venous insufficiency. Stay tuned for future episodes on related topics. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.